Everyone, I'm Dr. Leonard with Central Ohio Spine and Joint. Today I wanted to go over a topic and a question that we get pretty much every day here in the office, and that is about spinal manipulation, kind of what the purpose of it is and why we actually do it. So as a chiropractor, most everyone assumes that, we go in and crack joints all day long. And while it is a tool that we utilize with a lot of our patients, it is just that, it is a tool. It's a tool in a tool belt of treatments that we have. We use a combination of manipulation, exercise, dry needling, massage therapy, anything that we can in order to address the patient's dysfunction or anything that we find within the examination. But today I want to talk specifically about the manipulation portion. So with spinal manipulation, kind of the old theory with chiropractic care is that something kind of slipped out of place, and by thrusting on it, we're putting it actually back in. And over the last 10, 15, even 20 years, we've probably disproven that through the research. And the main thing that we're trying to address when we do manipulation is just joint stiffness, okay? What we found from the literature and the research is when a joint becomes stiff and tight, the sensory information that comes into the joint itself changes, and it can cause pain and discomfort. The other thing is when we see arthritic change start to occur, is arthritic joints tend to be tight and stiff. And so when we're working with a patient here, let's say for neck pain, the first thing that we're looking at is just kind of global range of motion. How are they able to move in the different planes of motion? And we're looking for big changes. We're not looking for minute little, asymmetry side to side. We're looking for large findings in this. So we look at kind of rotation side to side. We look at extension and flexion. And if we find that we're having a restriction in a certain range of motion, typically what we're doing is setting up in that position, applying a little bit of a thrust in order to mobilize the joint. Most people are familiar with hearing kind of a crack or a pop. And what happens is when that joint surface gets moved quickly through a range of motion through the thrust, is it actually creates a little gas bubble within the space, and that formation is actually the sound that you hear of the pop. So not everyone is a candidate for spinal manipulation. We try to do a very thorough examination in order to determine if the patient's the right fit for it, but it is a very, very valuable tool when we talk about tension, stiffness, and pain. We use it for cervical pain, lumbar pain, low back pain, mid-back pain, and really kind of any peripheral joint that we do as well. So if you have any questions specific to spinal manipulation, feel free to shoot us a message. Make sure to like and comment on this post, and we look forward to seeing you in the office.